Genital warts can be disappointing, very irritating, but they can be managed at some point. But it is what it is, guys. Welcome to our video. Yo, it's the African boy here, Vincent. Welcome to our channel, guys. Future Talks is our channel. I want to welcome you to our video today. We have something very interesting to share about. We have many sexually transmitted diseases, and today I want us to talk about the most common one, especially in Africa. I always do these videos from Africa, especially it's an African village setting. So guys, welcome. I want to share about genital warts. I don't know if you have ever heard of them. I don't know how you call them in your language, but in the various dialects they have a name they're called, but generally in the hospital they call them genital warts. Or when you have those some growth in your private area, we're going to talk about it. So what is the genital warts? Genital warts are commonly sexual transmitted infection or STI. They are classified as sexual transmitted infection caused by human papilloma virus. In my previous video, I talked about human papilloma virus, and early this year we had a month for Cancer Awareness Month. And kindly, if you've not watched the video, watch my previous video. You'll get to know more about human papilloma virus, what it means. So the human papilloma virus is very dangerous, and it can cause what we call now the genital warts. And most of these genital warts, most of the time they occur in especially the female gender. So how does one know if they are genital warts or not? So generally they appear small, they are fresh colored, and also they look gray in the genital area, especially it can be in the vaginal area. Most of the time it affects the female gender. So at the vagina area, you may find we have those small flesh colored or gray growths on the genital area, and also we have that the anal area, and also in the mouth. You can have them on the mouth, especially those people who practice anal sex, and also for those people who practice the oral sex, it can also appear there. So what are the signs and symptoms of this condition? So first we have like I've mentioned, small flesh colored or gray bumps in the genital area, anal area, and also in the mouth. Normally what you always how you classify these genital warts, we have clusters of warts that resemble the cauliflower. I think we know most of the time how cauliflower is. So if you have those colorful kind of growth in your especially the genital area, possibly that could be the genital warts. And I'm going to mention on how we're going to manage them. Also, somebody may be having itching, burning, or discomfort in the affected area, especially in the mouth, the anal area for those who practice anal sex, oral sex, and also at the genital area. Somebody may have those they may have that itching sensation or burning sensation in those areas. Also, the most common one is bleeding during sexual activity. So that's also can be those are the basic symptoms of the genital warts. What you should know about the genital warts: they are highly contagious, or they can be spread through sexual contact very easily, especially the vaginal area, anal area, and also on the oral sex. For those who do vaginal sex, anal sex, and also the oral sex. Most of the time, I have told you about the HPV, and I always have shared with you that you can go to a previous video on the human papilloma virus, and you will find a video on over the same, where I did some awareness over the human papilloma virus. It's very common, especially you get that in men. Most of the men are carriers, or men are carriers of this HPV. But when it gets into the human body, especially in the female, it can cause also the cervical cancer and also this problem of genital warts. So what happens normally if one has this HPV, we manage the symptoms, because HPV you can, or the human papilloma virus, if one has already gotten it, it gets into a challenge now to manage it. So it's very important that now we manage the symptoms, which are guys. How do we get to manage the genital warts? We have some simple ways of, or various ways of managing the genital warts. Number one is what they call topical medication, or you are given some prescriptions of medications which you apply maybe in your vaginal area or the anal area, or where the warts are, so that we get to freeze or get out the genital warts. Number two, what we have is what we call cryotherapy, where the genital warts are frozen. There's a special way they are frozen, and normally they use what we call nitrogen liquid, so that they get to freeze those genital warts, and they get to drop and get cleared from there. And number three, what we have is electrocautery. Electrocautery is where now you get to burn the warts off with an electric current. So where there's a special way, under controlled kind of there's a special machine for that electricity, where you get to electrocute those warts and get out the supply from them, so that they follow from where whatever, or the area which they have affected. Another thing which is done is what you call surgery, where the surgeon takes you, especially the gynecologists are the ones who do this procedure. They take you to theater and get to cut with a scalpel or a laser when you are under now, where you don't feel some pain. They cut them off, where you get now some anesthesia, and then they cut off with a special knife. They cut off the genital warts. Another way of managing them is what we call interferon injections, where you get the warts are injected into a special drug is injected into the warts to boost the immune system response to the virus, that's the human papilloma virus. Thereby now you get that when the immunity is boosted, now the warts gets to be taken off, so that one gets well from those genital warts. So it is important always, from various ways of managing this condition, it is always good to find the best way of managing them. So always with this problem, and because they are very common, I've described on how they look like a cauliflower, those growths in the anal area, the vaginal area, or in the mouth. So when you see the healthcare provider, especially the gynecologist or the doctor, can really manage them and also give you choose the best method for you as you discuss, and also come up with a solution so that you get to heal this kind of this condition. So with the depending on the risk involved of the treatment, the doctor will advise you accordingly on how you can easily manage them so that you get to the best way, and also you get to a level where the risk of infecting others is really reduced. So how can we prevent this condition especially? So the best way to prevent the genital warts is to avoid sexual contact with someone who has the virus that causes them. That is avoiding sex with somebody who has the HPV. But most of the time, you get most men are carriers of this virus. If someone is sexually active, so you get they are carriers of this human papilloma virus, and most of the time it doesn't affect the men. So it easily it's transmitted to the lady through sexual contact. So but the best way is to avoid now sexual contact, which is very limited because it is not very easy, because guys, you know what sex does to us, and also it's very important and also very vital to have that sex. So, and most of the time, like I said, most of these HPV uh, and also the spread of this kind of genital warts can be, sometimes somebody may have those genital warts and they may have no other complaint, or they may not be symptomatic. So someone may be spreading them through especially the sexual contact. So the major way of preventing this spread of genital warts, use condoms, especially for so that you reduce the risk of acquiring this or transmitting this disease. It's very important that you get to use a condom every time when you have sex, especially for those who have multiple sexual partners. It's very important that you involve yourself with the sexual with the condoms used. That way you prevent yourself from getting to the infection, and also you get to protect your regular sexual partner, especially with your wife, girlfriend. You have to protect them from getting those genital warts. And number two is to get vaccinated against HPV, especially because this vaccine gets to prevent the HPV from spreading, and also uh, and most of the time it prepares the body immunity so that one doesn't get into the infection. So and at the same time, the HPV also prevents vaccine also prevents one from getting the cervical cancer, because cervical cancer is most of the time caused by the human papilloma virus, which is very common. So with the HPV vaccine, it prevents one from various strains of virus that can cause most of the genital warts and also the cervical cancer. So it is recommended that for both males and females to get in other countries, but here in Africa, most of the time they focus on the girls, especially those who are below 14 years, especially if they are not sexually active, because now they have not been introduced to this HPV virus. So you get vaccinated so that you don't get to those strains of the HPV or the human papilloma virus. Also, another thing which is recommended is getting regular screenings, especially the ladies for cervical cancer screening, so that if you they get to detect the abnormal cells caused by HPV, which can develop into cancer, so that one is prevented to get into the cancerous kind of situation. So that regular screening, especially it is recommended once in a year. A lady gets to the gynecologist or gets to the reproductive health clinic to get checked on the human papilloma virus, or they be done the cervical screening, so that if there is an abnormal growth or the abnormal cells in the system of the cervix, it can get really approached. And at the same time, if you are protected from such kind of thing, and also your doctor can, or the healthcare provider can also determine if there are those other conditions like sexually transmitted diseases which are available there, so that you get to get assisted. Because most of the time such kind of sometimes uh, the kind of this kind of especially the genital warts sometimes can be asymptomatic, means they don't disturb you, they don't show any signs, but with time that's when they come now problematic, so that they give you a lot of issues. So it is very important for that screening, because it goes beyond now screening for the cervix, as also screens you for the health of your reproductive system. Also, it's very important also as a person to by practicing good hygiene practices. It's very important that you get to practice good hygiene by washing your genital area with soap, the mild soap. Earlier in my previous video, I've talked about vaginal smell, and we saw that we don't recommend highly perfumed or a strong soap. It's mild soap which is recommended. With water is enough to wash your pussy, or you wash your genital area, so that it maintains the hygiene, so that it can help reduce the risk of acquiring or transmitting the genital warts. Another very important aspect is reducing or limiting sexual partners. It's very important, it's very basic, it looks very simple, because most people, especially in Africa, we always see you deny you don't have many sexual partners, but people have very many sexual partners, and most of the time they practice unprotected kind of sex, which is not a very good thing, because it brings a lot of risks with it. So it is important to talk to your partner or your partners about your sexual history and the potential risks for STIs and genital warts. I'm told in some countries it is illegal to maybe infect another person, because you are supposed to know before you engage with someone on the sexual activity, you should have always known your health. So if somebody you engaged with in the sex and become sick, maybe of the STI, you are sometimes you are fined a lot of money, or you are incastrated, so that you get to pay a lot of that person who you have infected. So it's very important that you know you should also explain yourself to your sexual partner about your history of sexual partners, and if in the recent past or in the past you've had sexual encounters which could have disposed you to sexual diseases. So what it means is that have that regular sexual partner, and before you engage into that, go for a checkup to find out what is happening with your sexual health and also your partner's sexual health, so that you get to give the best, also to take care of the health of the other, and also as that person also takes care of you. uh, and always what you should remember, even when there are strategies to prevent you from getting the genital warts, especially, or they transmit the genital warts, uh, always it's good to take care of yourself, and also uh, The complications of genital warts. Complications of genital warts. Number one, we have psychological distress as an obvious kind of thing which comes up with the genital warts, because they may cause, if someone is told about the genital warts and they are not even aware they had them, there is that likelihood of having anxiety, depression, and other psychological issues due to the stigma surrounding the condition and its association with the sexual behavior. Obviously, if you go, especially if you go to a doctor who's bad mannered and they find you with warts, you will always conclude you are sexually immoral. But sometimes it's not like that, because some people get infected without even being aware, especially with these sexually transmitted diseases, including the HIV, which is very common in Africa. So it always brings that anxiety and also depression on someone who has been made the diagnosis of genital warts. Another complication of the genital warts, it may predispose you to the you are likely to go into a risk of cancer, especially the HPV that cause the genital warts can also cause cancer of the cervix, can cause cancer of the vulva, can cause cancer of the anus, can cause cancer of the penis, and also can cause cancer of the throat. So with the genital warts, it increases your chances of getting those kind of cancers. It also, another complication is the spread of infection. So the genital warts can be spread to other parts of the body through the skin to skin contact, or to sexual partners, even when there are no visible symptoms. So another complication over the same is now you get to spread it very fast to other people, or to the sexual or the contact, because also if someone gets into contact with the genital warts, they are really highly infectious, like I mentioned, so can really develop them even with the skin and skin kind of contact. It can also bring about the pregnancy complications, especially they may cause complications in pregnancy if one is pregnant. They may cause, especially during birth, they may cause what we call obstructed labor. And also at the same time, it may cause problems to the kid who is born, especially when they are born through the vagina. So it may also spread to the baby, and it is very serious when it spreads to the baby when born with a mother who has those genital warts as a complication. So it looks simple to have those genital warts, but sometimes it is very detrimental when it gets into the level in which now it also affects the pregnancies if one is pregnant, and also gets to affect the baby. So most of the time when a mother is pregnant, it is highly recommended now through the pregnancies considered a risk pregnancy for the baby and also the mother. And most of the time cesarean section is done for those mothers who have those serious genital warts. So they are delivered via cesarean section, so that you get to protect the baby and also not to cause more problems to the mother during the childbirth with the issues of obstructed kind of labor. So guys, it is important to talk to a healthcare provider. If you suspect you have genital warts or have been diagnosed with an STI, they can provide appropriate treatment options and offer guidance on how to reduce the risk of transmitting the infection to others. And regular screenings and follow-up care can help detect any potential complication early and prevent long-term healthy problems. So the key point is we should always go for a checkup, even if you feel your sexual health is okay. Your doctor or your healthcare provider will find something very important and something very vital, and approach it in time, so that you get to get the help. Guys, welcome to our channel. Future Talks is our channel. Kindly keep supporting the channel. I highly appreciate for those of us who are giving us feedback on how we are doing. And this channel is for us, it's not just for me. And we want to take this channel to another level where we get to learn about ourselves and also get entertained at the same time, and enjoy every moment when you come to this channel. Guys, welcome to our next video, and thank you very much. Have a nice time, guys. Thank you very much.